Sonia Jai Krishna, Jay and Jinendra.
Jai Shri Krishna.
Jai Shri Krishna.
Jai Shri Krishna.
I'm gonna unmute everyone. Sonia Jai Krishna.
Panaben, you are mute.
Panaben, we can't hear you.
Panna, you're mute.
I'm so sorry. I apologize. I muted I keep muting everybody because everybody is unmuted. I do apologize. Thank you very much again for reminding me. It keeps automatically going to mute. I beg your pardon. Swaha Tatsaviturvarenyam Bhargo Devasya Dhimai Dhiyo Yona Prachodayat Om Bhurabhuva Swaha Tatsaviturvarenyam Bhargo Devasya Dhimai Dhiyo Yona Prachodayat Om Bhurabhuva Swaha Tatsaviturvarenyam Bhargo Devasya Dhimai Dhiyo Yona Prachodayat Dhiyo Yona Prachodayat Dhiyo Yona Prachodayat. Sonia Jai Shri Krishna. I welcome everybody to see a full house. I'm all excited for Suraj Bhai to, demonstrate whatever he can tell us and teach us. Suraj Bhai Bafna is a musculoskeletal orthopedics physiotherapist in London. He leads he's a team of advanced practitioners. He's currently working for the Brent Integrated MSK Services, that is in brackets NHS, with an experience of over 6 years in physiotherapy. He is also MSK Injection Therapist. He has special interest in spine and MSK Sonography and offers virtual consultations across the globe. So I'm going to invite Suraj Bhai, and then we're going to have Q&A. I'm also going to invite Jyoti Ben Shah, and I welcome with the whole team of Women to Women. Suraj Bhai, please can you come and help us out with your musculoskeletal system and explain why we have these back pains, lower back pains, all sorts of pains. Can I invite you, please?
Yes, thank you, Panaben. I am going to, thanks for the introduction. Thank you all for joining. It really means a lot. That's a huge audience coming in. I hope I'm able to, meet your expectation at least by, minimum. I don't know if full, but as Panaben said, I will do my talk, and then after that, Jyoti Behan is going to help us with the Q&A session. So let's get started. I'll share my screen. Panaben, can you see my screen?
Yes, we can.
Am I audible clearly?
Yeah.
Okay, thank you. So today's topic is a hot topic, lower back pain. We're going to talk about, we'll stick to the topic because this is a very common topic in which we can go here and there. It's very common because with this, there's a lot of other things which can happen. So let's get started. Back pain, before I start, I would like to give a disclaimer that whatever you hear on this talk right now, it's just it's just a presentation and it is just an overview. It is not a medical advice. So if you have any concerns or anything, please speak to your GP or your medical expert or any expert and then take it further from there. આજની જે talk છે, આ talk એક ખાલી આ presentation માટે છે. Whatever I say today is, you don't have to take it as a medical advice. अगर તમને medical advice કઈ જોઈએ છે કે તમને કઈ expert advice જોઈએ છે, તો you should speak to your GP કે તમારા physiotherapist સાથે or any other healthcare professional. Now, what we see in front of us, this is a spine. તો જે તમે આ સ્પાઇનમાં તમે જો છો આખો મણકો છે from top to bottom. Okay, this part here is the head જે missing છે અહીંયા skull હોય ઉપર, એના નીચે આખા મણકા હોય, and this is from the front. આ આગળનો વ્યૂ છે. અગર તમે માણસને સામેથી જો, અગર તમે મને જો છો તો આ મણકા કેવી રીતે બોડીમાં દેખાય છે, આ ફર્સ્ટ જે ઇમેજ છે એનું છે. ઓકે, જે સેકન્ડ ઇમેજ છે એ પાછળથી છે. તમે પાછળથી મણકાને જો તો કેવા દેખાય, અને જે થર્ડ છે એ તમને સાઈડમાંથી, તમે સાઈડમાંથી જો તો મણકા કેવા દેખાય. નાઉ તમે આ સ્પાઇનને જો તો આ શું છે, આ સ્મોલ બોન્સ છે જે એકના ઉપર એક બધા સ્ટેક કર્યા છે. ઓકે, તો આ એકના ઉપર એક જે સ્ટેક કર્યા છે ને, આ મણકા છે નાના નાના. આ એક મણકો, આ બીજો મણકો, આ ત્રીજો મણકો, આ ચોથો મણકો. So like this you have bones stacked one over the other. આ બંને મણકાના વચ્ચે, okay, ગાદી હોય, which is called disc. Okay, now આ disc અગર નહીં હોય ને તો મણકા ઉપર મણકો અગર હું રાખું તો આ એક લાંબી રોડ થઈ જાય. It would become a stick. Okay, but because you have the disc over there, what it does, it allows mobility. તમે bend કરી શકો છો, movement કરી શકો છો, અને એનું કામ છે shock absorption. Okay, ત્રીજા જે સૌથી ઇમ્પોર્ટન્ટ સ્ટ્રક્ચર્સ હોય છે મણકાના, ઓકે, એ છે નર્વ્સ. હવે આ ફરી પાછળનો ભાગ છે. આજની જે ટોપિક છે ઇટ ઇઝ ઓનલી અબાઉટ લોઅર બેક પેન. તો ખાલી નીચેના 5 મણકા. ઓકે, તો લંબર સ્પાઇન જેને તમે સાંભળ્યું હશે, ઇફ યુ એવર હેડ એન એક્સરે ઓર એન MRI, તો એ લોકો કે
Suraj bhai, can I just give you a second? People are asking, you are going to speak in English as well, ne? Explain in English, because some of them do not understand Gujarati.
Yes, I will try to strike a balance. If I deviate, please come and remind me again, Pannaben.
Okay.
Yes, I will remember to speak in both. So what you see right now in front of you is, on the left is the image of your lumbar spine with your pelvis. Okay, so આ છે lumbar spine na manka pachharthi, and this is the spine, this is the pelvis. Away for today's talk, our interest is around these 5 bones here. Okay, now in this is from behind. As I said, this is the view from behind. આ જે yellow structure જે દેખાય છે ને, okay, આને કહેવાય નસ. These are your nerves. Okay, so these nerves come there. So these nerves on the side, they arise from your spinal cord. So spinal cord is this, which is, which starts from your head, it goes down, and then it turns into small nerves, and these are the nerves. આ બધા level પર, at each level, if you see there is a nerve which is coming out. Okay, so what I was explaining, that one over the other. Now I'm going to show you on a model. I think you all should be able to see this. Okay, if not, I beg your pardon, but I will try to show it on the screen, later again on the image which are there. So this is the manka, or this is the vertebrae. Okay, now this is the disc, the jelly in between the two bones. So you got these two bones, okay, and in between is the jelly. Now, so this is the front view. This is if you were to see me from the front. If you see me from behind, you will see a similar image as what is there on the screen. Okay, so આ પાછળનો ભાગ, આ સાઈડમાં yellow દેખાય છે. These are your nerves. They start right from the back. આ ક્યાં છે હમણાં? If everyone's with me, this is your lower back. તો આપણે lumbar spine માં છીએ. This is in your lower back. From here, your nerves start and they run down into your toes. Okay, they run into your thighs, into your knees, into your calf. So aakhi jagah they supply until the end of the toes. Okay, so these are the nerves. Now the fourth structure which is important, okay, jem gaadi na char paiya hoy, em spine na pan there are four, I say there are four wheels of the spine. The fourth wheel, which is the most important wheel, is the muscles. Muscles are all around it. Okay, now muscle શું કરે? Muscle જે હોય ના, એ આખું corset બનાવી દે. It's like, have you seen someone wearing a belt, a lumbar belt? Okay, when you have back pain, or when you or if you see a pregnant lady or someone, they will try to wear something around the spine. That exact thing which is how you wear it is exactly how you have muscles around your spine. They are your muscles. Now these are the four most important structures. I am talking about them because we are going to need to understand that how they play an important role in back pain. Now on the right of the screen, what you see is the side image, okay, of your spine. This is the front part and this is the back part, and this is the nerve which is coming around, which I was showing you on the model. These are the discs in between. Okay, this is the jelly. Now let's start with what is back pain. Now got some facts here. It's very very important that we understand કે આ બધા facts શું છે. જે lower back pain છે, very common. In my opinion, once in a lifetime to badane આવે છે. You will get lower back pain. It is very very common. Back pain alone, okay, NHS ના ખાલી એક સર્વે માં અમે લોકો જોયું કે 40% of the people who are off sick is because they have got back pain. So can you imagine how many people have back pain? Okay, overall આપણી economy ને 10 billion pound લાગે છે just for back pain. So this cost is for everything, the care, the other issues because of the back pain. It is also one of the largest single cause of disability. Okay, most of the patients, okay, who have disability will always back pain also over there. Now, and it accounts for at least 11%. 11% લોકોને જેને disability છે, 100% માંથી 11% તો ખાલી chronic back pain છે. એના લીધે એ લોકો disabled છે. Okay. Now, what is lower back pain? Lower back pain means pain in your lower back. તમારા મણકામાં નીચે, around your lumbar spine, કે around the lower back, જેને કહેવાય આપણે કહીએ કે મારી કમરમાં દુખે છે, નીચેની કમરમાં. That is what is lower back pain. Okay. Now our back pain it can occur because of multiple reasons. There is no one cause for back pain. Always remember, there is never one cause. Okay, I have a disc issue and because of that I have back pain, or I have got mara manka gasai gaya che ena માટે I have got back pain. There is never one cause. There are multiple causes which can lead to back pain. Okay. Now the other most important thing which you need to remember is sometimes you can get back pain which is sudden onset. તમે થોડું કઈ કરો, તમે નીચે ઝૂકો, and if you're trying to you bend down and you try to pick something and you feel that you go down and you are just caught up in that and you're like, oh my god, ouch, dukhe cha, it's paining. That is sudden onset back pain. It could be when you try to suddenly lift a suitcase which is 20 kilos or 10 kilos, or sometimes it can also be just lightweight, it's just the way you bend or twist that can give you that pain. So what comes suddenly, je achanak thi ave ene kehવાય sudden onset back pain. Biju hoy gradual, okay, je dhire slowly and steadily it will come up. So that is the other type, which is gradual onset back pain. Now because of back pain, people have varied amounts of pain. Someone may have just very little pain, થોડુંક જ દુખે છે, versus someone has moderate pain, versus someone has a lot of pain. આટલું દુખે કે they are crying, they can't get out of the bed, they are bedridden for weeks and weeks. Okay, so the intensity of the pain can vary, but this is all normal. This is what we see normally with lower back pain. Okay, now with type of back pain, you have to remember there is, for medical differentiation કે classification માટે અમે કહીએ acute અને chronic. acute એટલે શું, જે back pain જે શરૂ થયું ત્યાંથી 3 મહિના સુધી હોય તો એને કહેવાય acute onset back pain. Okay, અને જે chronic હોય, જેને પણ back pain more than 3 months હોય, એને કહેવાય chronic. Okay, now when we talk about this most common reason for disability or sickness absence, it is the chronic type of back pain also, which is very commonly seen more than the acute. Okay, which leads to all these things. Now this is just an overview about what is back pain and what are the facts about back pain. Now going to what are the causes of back pain. As I already said, that there is no specific cause. There is nothing, nobody has been able to identify that this is one reason for the back pain. Okay, that's why we call it that 85%, 85% je back pain hoye, it is non-specific. Okay, it's a non-specific back pain. We don't know what is causing it. Okay, it can, sometimes you might just pull a muscle, sometimes you might just bend in an awkward way and you can get it. So there is no one cause for back pain. And remember, very rarely, okay, very rarely, bahut kam wakhat back pain is something very serious. Now this is very important. Lokone normal back pain થાય, when you get back pain, people start panicking quite often. Okay, so I am hoping ke ajna talk na pachi at least you know that what to do when you have back pain and how do you manage it and when do you flag it up. તમને જ્યારે બેક પેન થાય ત્યારે તમે શું કરો અને ક્યારે તમારે એક મેડિકલ હેલ્પ લેવાની, એ તમને આમાંથી ખબર પડવી જોઈએ આજના ટોકથી. ઓકે, એન્ડ હાઉ ટુ મેનેજ. માય હોલ એમ ઇઝ ટુ ટોક અબાઉટ થોડા મિથ્સ કે બેક પેનમાં શું છે, અને બીજું હાઉ કેન યુ મેનેજ એટ હોમ. ઓકે, નાઉ ધીઝ આર ધ કોઝિસ ઓફ બેક પેન. નેક્સ્ટ ઇઝ, now I'm talking about few common myths which we see in back pain. Back pain na sathe there is a lot of myth. Okay, and I'm going to explain very briefly as to why do I say that these are myths and what is the reality about it. Now your back is very strong. Okay, it is stronger than you may think. Sometimes patients come into my clinic and they tell me, oh God, I've got so much back pain, I think I've fractured my bone, I've fractured my vertebrae, ke main maro manko તોડી દીધો છે. Okay, or they will come and say that મારી disc આખી બહાર આવી ગઈ છે, my disc has completely come out. Okay, so you can have people saying that also, but you have to remember that your back is very strong. Okay, it is very it requires a lot of force to break a bone in the back. It cannot just break on its own by you not doing anything major. Now back pain, as I explained, you can have different intensity and it can be very disabling. Okay, and બીજું છે કે you can have repetitive episodes. તમને અગર એકવાર થયું, if you get it once, you can get it again and again. There's a chance that you can get back pain again and again, and we'll try to understand that why you get it again and again. Okay, but as I mentioned before, it is rarely dangerous. It is never something very serious. I will tell you what are the signs which you should look out for, which are serious signs, but you have to remember that it is very rarely something very serious or nasty કે એકદમ કાઈ સખત ખરાબ થઈ ગયું છે કે એવું કાઈ. Now I'm going to spend a little time on this slide, okay, because it's very important that we understand કે આજે x-ray, MRI કરવાની જે ઈચ્છા હોય બધાને, whenever patients come in, most of the times what we hear from them is that, at least to my clinic, I sit as an advanced practitioner, as Pannabin was saying. We have a lot of patients who come in and who say, "Mane X-ray joye che, mane MRI joye che." Okay. Now, in my opinion, very, very rarely does a person require an MRI or an X-ray. Okay. Now I'll explain you why. Jare, when you come to us, with your complaint, okay, we ask you your history of what's going on. What is the story basically behind your pain? તમને અમે લોકો તમારી સ્ટોરી પૂછીએ કે આ કેવી રીતે શરૂઆત થઈ, શું થયું, okay? Now, when we ask all those questions, એમાં બહુ બધા question પૂછીએ. We ask you a lot of questions to understand કે આમાં કઈ serious છે કે નહીં. Okay, 90 to 95% of the time, okay, 90 to 95% of the time, ખાલી history થી અમને ખબર પડી જાય છે કે શું wrong છે. Okay. Only 5% of the cases we might examine એટલે તમને બેડ પર સુવડાવીને તમને ઉપર નીચે જોઈને કરશું અને ખબર પડશે કે શું થાય છે. And only 3 to 4% or less than that also require any imaging. Okay, imaging એટલે X-ray કે MRI. Now, Fari, let's understand this pathway. Tame jare aavo, tamne we ask a lot of questions. Okay, lot of questions. You tell your story. Tame શું થયું, કેવી રીતે કર્યું, where is the pain, શું કરવાથી દુખાવો વધે છે, કમ થાય છે, દવા લો છો તો એનાથી સારું થાય છે કે નહીં, when you take medications, are you getting better, worse, what activities make it better, what activities make it worse. So we ask you a lot of questions to understand that what is going on. Okay, and we can diagnose you even with just the history. Okay, now why do I say that you rarely need a scan is because if you need a scan, that means we are suspecting something very we don't know what's going on with your back. There's a possibility that we don't know what's going on, and we want to ensure that there is nothing sinister. Scan MRI ni kyare zarurat pade when we are suspecting something nasty, something which is bad. Okay, something which is going to require further intervention. ત્યારે જ એની જરૂરત પડે. રૂટીન બેક પેનમાં તમને 2 હપ્તાનો દુખાવો છે, 4 હપ્તાનો દુખાવો છે, 6 weeks back pain, 8 weeks back pain, 12 weeks back pain. In absence of anything serious, there is no need for a scan. Okay, now in my opinion, scan can do more harm than good. Why do I say that? Now, agar tame study jo na, it's people who do research and all would know that this is a systematic review of a lot of papers. So our research hai. This is a research done wherein a lot of researches were put together, and we were trying to see that at each age, okay, what do we see on an MRI? Okay, now let's talk about before we go ahead on this. When you all ask for an MRI or an X-ray, tame jao and you ask, that I've got back pain, I need an X-ray or I need an MRI. You have to understand that that is not going to treat your pain. You've not come to us to treat. You have come to us to get your, to understand what is going on and how do you, manage your pain. But doing an MRI or an X-ray is not the answer for that. Okay. Now, when we X-ray or when we MRI, what do we see on that? We see on X-ray, we see bones. Okay. On MRI, we will be able to see the bones, the soft tissues, the disc. Okay. જે ગાદી મેં જે તમને કીધું, જે મણકાની હાડકીઓ એ જોવા મળે. પછી જે નસો બહાર નિકળે છે, એ નસના ઉપર શું છે, what is going on around the nerves, that all can be seen on the MRI. Okay. Now, the gadi, the disc which I showed you between the two stack of bone, there is a disc. Now that disc has got these changes which can happen, which I have mentioned there. There is degeneration. So if someone's got an MRI already done, they would know, they would have heard these terminologies before. તમે આ સાંભળ્યું હશે કે મને ડિસ્કમાં degeneration છે, કે signal loss છે, કે મારી ડિસ્કની height કમ થઈ ગઈ છે, કે I've got a disc bulge or I've got a disc protrusion, and it comes with a number. મને L5 S1 માં disc bulge થઈ ગયું છે, or I've got L4 L5 disc protrusion. Funny enough, what happens is when patients get an MRI done and when they come to us and we ask them, where is your pain? They will say, oh, my pain is in L5 S1 region. Well, body ma, they don't know where is L5 S1, and when they put their hand, it is way, inches above that L5 S1 region. So this is why, I thought I'll bring this up and I'll explain you that why MRI is not indicated and what harm does it do. Now, if you see the numbers here, આ બધા જે ઉપર છે 20, 30, 40, 50, this is the age group. Okay. Now, this research is done on people who did not have back pain. Okay. Remember, this research is done. આ ખોજ એ લોકો માટે કરી છે જેને કાઈ પણ back pain નહોતું. They did not have any back pain. Okay. તો આ રિસર્ચમાં એ લોકો શું જોયું કે 20 વર્ષના જે લોકો છે, okay, 20 years old જે હતા એ લોકોમાં 37% લોકોને તો disc degeneration હતું. But remember, mind you, these people do not have back pain. None of these patients had back pain. Okay, 37% of the people had disc degeneration. Okay, now let's go to 70-year-old and 80-year-old. 93% and 96% ma there was disc degeneration seen. Again, these patients are not having back pain. So you've taken a scan of a person who's not having back pain and you are already seeing these changes. You see in a 50-year-old 68% disc degeneration hai. 33% ma tamne disc protrusion dekha hai. Okay, in 8% you will see a listhesis or facet degeneration. These are different things which you can see on the MRI. The point which I'm trying to make is, even in a normal person, these changes happen. How I explain it to my patient, what I tell them is, jem tamne skin ma jhuriyo thai, you get wrinkling of the skin. Okay, you get white hair. The same way in the body, the bone and the disc and all these structures, e lokani jhuria etle આ બધું છે. Okay, this is how they age. This is how they age in general. And this is also what we say, that these are degenerative changes. Okay, or these are age related changes. There is no control of anyone on this. You cannot stop this. Nobody can say that I want to stop aging. It's not possible. Okay, you have to, this is going to be a part and parcel. So if you come to us and we send you for an MRI, your MRI will show changes. But is that the cause of the pain? Is that why you're having the pain? Is the answer to that question is only on my questioning, the questions which I ask you, and my examination. As I said, 95% of the times we can 100 patient જે ક્લિનિકમાં આવે એમાંથી 95 patient ને હું ખાલી એ લોકોથી એની સ્ટોરી સાંભળીને એમને અસેસ કરીને કહી શકું છું કે શું તકલીફ છે. ઓકે, હવે સેકન્ડ રીઝન why I think that this does more harm is, તમે MRI કરો, you get an MRI done. After that also, the way your condition is managed does not change. Okay, you come to my clinic, you say you need an MRI or an X-ray, we send you for that. You come, we call you back with the results. Even with the results in front of me, even if it shows disc degeneration, protrusion, ke આ બધું જે પણ અહીંયા મેન્શન કર્યું છે, આ બધી ચીજો પણ હોય, we are not going to send you for a surgery or an injection just on the basis of the scan. અમે scan ને નથી treat કરતા. We are treating patients. I will still come back to you and ask you that how do you feel? What are your symptoms? તમને શું કરવાથી દુખાવો વધે છે, કમ થાય છે? Okay, so this is very important. So always first go to your GP or to your physiotherapist or whoever, to a health professional, and tell them your story and hear them out. Follow what they say and then build up on that. See, for us it is very important that we make sure that we take care of you in the right way. Okay, there's a lot of medical legal framework also. If we miss something serious, okay, it is going to cost us our work. તો અમે તમારાથી વધારે vigilant રહીએ કે અગર તમને કઈ લાગે, or if you need a MRI or an X-ray, we will send you for that. So don't worry. Now going to the third thing, when you get back pain, what most often people do when they get back pain, immediately they start resting on the bed. They go for a complete bed rest. Okay, my suggestion is that avoid bed rest unless and until it is really required. Okay, you should stay in work and you should gradually resume your activities. Now again, bear in mind what I mean here is, agar tamne, if you're getting a pain which is manageable, I would highly recommend that you keep yourself on the move within your pain bearing capacity. I am not saying that tame dukhavama pan, in your pain also you try to be as active as you were before. I am not suggesting that. but I'm suggesting that you all should make an attempt to be as active as you can, because being active, okay, just being active with back pain helps to resolve it. Okay, તમે અગર normal કામ કરતા રહો જે તમે કરો છો within your pain bearing capacity, you will still start feeling a change and you will start feeling better. Okay, first. Second, if you go down and have bed rest for 1 week, 2 weeks because you've got back pain and you can't turn and you can't twist and everything, you have to understand that the body is going to go further. It is going to further decondition. તમે તમારી જે તકલીફ છે એમાં અગર તમે, if it is too bad, then yes, I would suggest that you can have a relative bed rest. Okay, unless there is anything sinister, kai biju che, you broken a bone, or we are talking about normal back pain. We are not talking about anyone who's broken a bone or who's got a fracture or anyone of anyone of that sort. We are talking of general people who've got only normal back pain. Those people should try to keep moving. Okay, even if you go for bed rest, go for a very little while and then make as much movement as you can. Okay, now I also recommend that to all my patients, that try to get out of your house, try to go wherever you can. Obviously now there is lockdown and I understand these measures, but my point is that try to be active. Don't stay in bed, because staying in bed, if you don't become active, you're further going to, your pain is further going to just add, increase because of inactivity. Tamara muscle je che ene kaam karvu che. If you don't make your muscles work, or if you don't make your body move, it is only going to further decondition. Okay, which we don't want. Now, this is a very, very important message. Remember that the amount of pain which you get does not mean the amount of damage. Oh my God, mane atlu dukhe cha, I am in so much pain. I am sure there is drastically something wrong in my back. Drastically. Sorry, that's not the case. Oh, I have very little pain. There is nothing, I can bear with it. And it does not mean that you don't have anything, major in the body. So pain intensity, or your pain, level of pain, does not tell you that how much damage is there in the body. Now, this is what we commonly do. If we have a lot of pain, then what we do is we immediately try to protect ourselves. Okay, this is the natural mechanism, defense mechanism active thai jai. You then try to not be as active, tame bed rest par jao, you try to just be in the house, you are being very cautious with your movements and everything. But remember, pain does not equal damage. A very simple example I give is, sometimes you can get when you have an A4 size paper and you get a cut, and it can sometimes bleed, and you might also get tear from your eye for just a simple thing like this, or you just bang your hand somewhere and you can get a tear. Versus you have people who are in the military, okay, who take a bullet and who still stand and they are still fighting, okay, until the last bullet is going in or something of that sort. The point which I'm trying to make is that the intensity of pain does not mean anything. Okay, it does not mean that, it does not mean that higher the pain, higher the damage in the body. Okay, so this is your perception of pain. Je tamne pain nu je perception che, okay, pain je feeling che na, it's a feeling. આ બધી તમારા મગજમાંથી આવે. It all comes from the brain. Okay, so it is all from your past experience. તમને કોઈએ શું કીધું છે, I'm going to address that later again in the next slide, I think, but I will come back to it, that how pain is affected by the intensity of pain. કેટલું દુખે છે તમને, it is affected by how you think and how you perceive it. Just 1 second, sorry. Now, when back pain happens, what people tend to do is, the first thing they do is they don't want to bend. If I ask them to bend, what they do is, I don't know if you all can see me, but they try to go like this. Okay, they will go like this if you try to bend, or they will try to be very stiff. I always suggest that do not fear bending. There is a very, very common myth which is told to everyone. I don't know if most of you should be able to relate to me. If you had back pain, most of your relatives or someone what they will say, oh, don't bend, don't lift, don't bend, don't lift. Okay, but there is nothing like that. There is nothing. You should not fear bending or lifting. As I said, the key message is work within your pain bearing limits. તમારી જે pain સહન કરવાની શક્તિ છે, એ શક્તિમાં તમે કામ કર્યા કરો. Remember, your body has a very, very, very classical way of talking to you. Okay, and it will tell you when to stop. So I'm not saying that you go, after today, you just start doing everything, even if you have back pain. I'm saying be cautiously active. Listen to your body, see what your body is saying, and try to be as active as you can, because that's the best treatment for back pain. Now, they very commonly say that bending and lifting is one of the causes of back pain. It's only because these are the common positions which you take when you get back pain. But just think of your day, okay? Think of the day, the whole day. Is there anything in the day in which you have to go backward? Do you do anything like this? Do you wash clothes like this? Do you go, I don't know if you all can see me correctly, but do we do anything here? It is the lifestyle which we live is all forward bending, okay? Hence, you get pain when you are in this position. Okay, if there was any activity which was backward bending and if that would give pain, then you would associate that, oh, that is causing back pain. Do you get my point? So it is just કે આપણી લાઈફસ્ટાઈલ જ આવી છે કે આપણે બધું આગળ ઝૂકીને કરવાનું છે, અને એમાં અગર તમને એક દિવસ પેન આવી ગયું તો એ તમારા મગજમાં નહીં બેસવું જોઈએ કે bending is causing back pain or lifting is causing back pain. Okay, so do not fear, try to do that within your limits. Okay, and also very important on this note is that vajan, okay, lift, how much weight, whatever you can, you should try to do. I keep saying that again and again. Okay, you will keep hearing this again and again, but the key message of back pain, of treating back pain, is work within your pain bearing limits. Okay, so don't be scared of how much weight you're taking, or how much you should lift. It is too much, oh my god, 5 kilo chair, oh this is 10 kgs. Sometimes you just give someone an empty box and you tell him, okay, I'm giving you a 5 kg box in your hand, and if they have got back pain, even before they take it in their hand, they will start getting back pain. Oh my god, vajan che. Okay, but this is anticipatory pain. This is all in your brain. You are thinking that, oh my god, it is like that, but there is nothing. There is no actual 5 kg weight there. Okay, now going to the next slide. Exercise and activity reduce and prevent back pain. I'm going to come back to this later. Okay, this is a common thing. Everyone knows about it. If you don't know, you should know. Okay, exercise and activity is only going to help you to prevent back pain. Okay, if you keep yourself active, if you keep doing exercises, you will remain fit, and it will help to prevent back pain. It's not that people who exercise do not get back pain. That's not the message which we're saying, but we're saying that if you keep being active and if you keep exercising, then you will always have a tendency to not get it. Okay, so try to be as active as you can and exercise as much as you can, and that will help you to prevent from getting back pain. And always when you start exercises, because of that, you all should not go and start 10k walk tomorrow, 1 hour of exercise tomorrow. You have to go slow and steady. Okay, now painkillers, very common. What everyone does is, if they get back pain, they will take a paracetamol. Okay, 6 hafta, 12 hafta, few people take it for years, and I don't understand. There is no evidence. તમે chocolate ખાઓ કે paracetamol ખાઓ. For chronic lower back pain, paracetamol નું કાઈ effect નથી. It is not going to do any good to you. It's all in the brain. તમને લાગે છે કે it is making you better, but there is nothing which it is doing. Scientifically કાઈ નથી કરતું એ. Okay. There is no strong evidence also કે જે તમને normal back pain જે તમને થાય, which is acute back pain, એને પણ લઈને અગર medication થી તમને exactly કાઈ થાય છે. Okay, it is all basically it is all how you perceive it. It is very important. That is important. Now when what we are trying to say is that painkillers alone nahi levani. You should not rely only on painkillers. Ke mane back pain che, if I've got back pain, I will only pop painkillers and I'm going to get better. That's little over ambitious. And if you're getting better, that's nothing to do with your painkiller. That's the natural recovery. કોઈને શું હોય, અરે આ મંજુ માસી મને કીધું કે when she had back pain, આ 2 દવા લીધી and she was fine. Okay, that is completely a myth. That back pain, અગર એ મંજુ માસી 2 દવા નહીં તો અગર 2 ચોકલેટ ખાતા હોત ના કે કઈ પાણી પીધું હોય બીજું, તો then also it would get better. Then she would say આ 2 ચોકલેટ ખાઈ લો અને આ ચોકલેટ થી ઠીક થઈ જશે. It is also the timing, when you're getting better. So only painkiller is not going to get you better. It has to be done, if the pain is too bad, yes, you need to manage the pain to allow you to exercise. તમારે પેન કિલરની જરૂરત ક્યારે પડવી જોઈએ? When your pain is too bad, it is excruciating, unbearable, because at the end of the day we want you to be active, we want you to exercise. But if you cannot exercise, okay, because of the pain, high pain intensity, if it is affecting your sleep, if it is affecting your activities of daily living, બધું કામ હું કરું છું, મને દુખે છે, સખત દુખે છે, I cannot move, I cannot get out of the bed, that is the time when you need medication. Okay, but other than that, if you have got mild to moderate pain, okay, if 0 to 10, 0 is no pain and 10 is excruciating pain, તમારે A&E જવું પડે. Anything between 5 to 6 out of 10 is okay. You know, I don't think that is real, but also it will differ individually. Okay, but 5 to 6 out of 10 should be bearable. You should try to manage it as much as you can without medications. But if it is beyond that or beyond your capacity, you know, your bearing capacity, then you should take medication initially to calm the pain down and then get you going. Okay, but again, the answer is not in paracetamol. Speak to your GP and your pharmacist as to which medication you should take for that. Now, exercise is the best medication. In my opinion, movement is medicine. Remember, movement is medicine. The more you move, the more you're going to get better. So exercise and move. That's what you need to do. Okay. Surgery. Mane kamar dukhe che, I've got back pain. I don't think anything is going to help me. Surgery is what I need. Okay. Surgery is very rarely indicated. Again, remember, we are talking about only lower back pain. We are not talking about sciatica, nerve ma tamne dukhe che, nas ma dabav padi gyo che. Not that. We are talking about pure lower back pain agar tamne che. So the very, very few conditions, you know, you will require a surgery, and most likely it is going to be something which is, you know, not mechanical. It is something else which is noted on the scan, and ena mate tamne surgery jose. But for back pain, very rarely do you need surgery. There are a few conditions jena mate surgery ni zarurat padi sake che, okay, which is listhesis and all, but I'm not going to get into details. But normal back pain je apanne thai for the aam janta, you know, every time, if it is the first episode of back pain, second episode of back pain, ema very, very rarely do we need surgery. Okay. Sleep. I keep telling all my patients, it is very important with back pain to get good sleep. You should get at least 6 to 8 hours, 7 to 8 hours of sleep. If you don't sleep well, you don't rest well. If you don't rest well, you will feel, you know, restlessness. You will feel weak. Your muscles are not getting, your body is not getting to rest. Tame time to time khawanu khao cho, you need it because you're hungry. The same way, body also needs to disconnect and go off to sleep. Okay, and then body needs to rest. If you don't give that rest to it, and if you keep being on the go, okay, and you're not getting good sleep, then it will surely affect your back pain. Okay, it will affect you from you know, multiple things in multiple ways, not only back pain, but it can also lead to so many other medical conditions. So try to get good sleep when you are you know, in general, I'm saying in general, get good quality sleep to you know, prevent getting back pain. And even when you are having back pain, try to get good sleep. It is sometimes with a lot of pain, it's difficult, and that's when, you know, sometimes you might have to take some specific medications to calm the pain down, to allow you to sleep better also. So it is good for શું કહેવાય, રિવાઇવ કરવા માટે તમને આ જરૂરી છે. ઊંઘ થવી જોઈએ 7.5 8 કલાક, 6 કલાક, 7 કલાક, 8 કલાક, whatever. Okay. કોઈ મેટ્રેસ આવું નથી કે આ ઓર્થોપેડિક મેટ્રેસ લઈ લઉં કે જમીન પર સૂઈ જાઓ કે, you know, should I get this new ad I have seen and this mattress is amazing, and you know, you see ads. I sleep in whatever you are comfortable. If you sleep and you're getting good sleep and you're comfortable, that's the best mattress for you. Everyone has got a different perception of what is the best for them. Okay, so I do not really recommend that, you know, use this or use that or do that. Tamne je saru lage, whatever you feel comfortable in, use that. Now remember that you can have back pain without any damage or injury also. Tamne body ma, as I said, 85% of the back pain is non-specific. Tamne body ma kai tutyu nathi. As you remember that slide, pain does not equal to damage. Okay, so body ma kai tutyu nathi, kai pull nathi thayu, kai nahi. But even if you don't have all these things, kai you know, there are no changes. જે તમારો બોડીનો જે સ્ટ્રક્ચર છે, મણકાના સ્ટ્રક્ચરમાં કઈ ચેન્જીસ નહીં થયા ને તો પણ તમને બેક પેઇન થઈ શકે છે. ઓકે, જેમ કે if I get a cut, then it will bleed. Okay, so in back pain it does not work like that it is just going to it will only, you will have pain even if you don't have any cut or any damage in the spine. Okay, Now, what factors contribute to that is very important. Say લીધે તમને દુખાવો આવી શકે કમરમાં. Physical factors, okay, which is તમે તમારી કમરને પ્રોટેક્ટ કરવાની કોશિશ કરો. જેમ તમને ઝૂકવાનું કીધું કોઈએ, તો people try to go straight like this. They would go, okay, I'll lift it up and this, okay. These are the things which can sometimes lead to, if you are overprotective to yourself, તમે એકદમ બહુ stiff રાખો છો પોતાને, and then suddenly you try to do a movement, then you can get. Psychological, very, very important. If someone's told you, if you bend down, you will get back pain. If you take that thought to your head and you start believing in it, then it is 100% going to give you pain. And as I say, it is anticipatory pain. Even before you bend down, you start feeling pain. Oh my God, it's paining already. But there is nothing structurally happening. Tamaru andar kai tuttu nathi ke khechatu nathi ke kai nahi, but you start feeling that. Okay. Sometimes also when we are stressed, काम होए घर में, or even at work, if there's a lot of stress, then also your back pain can increase. It also affects your, mood and everything. So even if your mood is not good because of XYZ reasons, then also you can get back pain, which is the social triggers. Agar tamara घर में, you've got problem with your relationships, with your wife, with your kids or something, or your relationships at work, or you're not happy, stressful life है, तो पण तमारू back pain trigger થઈ શકે છે. You can get back pain and it can trigger. Okay, even general health and lifestyle factors. તમને અગર generally તમને સારી sleep નથી આવતી, if you're overweight, if you're not getting, if you're not doing enough physical activity, you're not having a, good eating habits, generally અગર તમે સારું નથી કરી શકતા, then also you can get, you can get back pain. Also, it is important that pain, if you are getting pain, it is 100% real. I am not saying that you don't have pain, okay, but you have to understand, and it is 100% real pain. It's not in your head, but sometimes all these other factors can affect that pain. It can modulate. તમને stress થઈ ગયું તો pain વધી જાય છે. તમારું stress કમ થઈ ગયું તો your pain is going down. તમારે there is something to do with work કે નહીં તો social કઈ friend ને કઈ થઈ ગયું, if that's on your head, or you're generally worried about anything, it will go up and then again it will come down. So each of these factors જે આપણે પહેલા discuss કર્યા, all these factors can tune your pain up and tune your pain down. These factors are not, there is no structural damage. Body માં કઈ તૂટ્યું નથી, but it can still tune your pain up and down. Okay, તો આ tune જે ઉપર નીચે કરે, આ તમારું મગજ કરે. So you have to have good control over your mind, your thoughts, hence mindfulness, meditation, and all these things are also important for someone, who's getting back pain. If it does not clear up, seek help, but don't worry. તમે 6 હપ્તા, 8 હપ્તા, 10 હપ્તા try કર્યું, whatever I tell you today, you've tried, and if it's still not getting better, then it's important that you go to your GP, you go to your physiotherapist, you go to your health professional, speak to them, tell them what's happening, and then they will be able to guide you. Okay, as I said again, let them guide you, tell them your story, and let them guide you as to what's the next step and how do we go ahead from there. Now, this is what when you go to them, what they are also going to do is they're going to ensure that there is nothing else going on, and this is purely mechanical. Okay, agar mechanical hase, bau commonly શું થાય, તમે GP પાસે જાઓ, if it is more than 8 to 10 weeks, then they will send you to a physiotherapist. If it is less than 6 weeks, they will give you an exercise sheet and say trial these and see how it goes. Okay, but routinely, I hope that the GPs are not prescribing too many medications to you on a routine basis, and I do not recommend on routine basis you should pop painkillers unless if it is really indicated. Okay, now should I go to a chiropractor, an osteopath, massage, Ayurveda, homeopathy? I have my only stake on all these things is you trial everything, whatever you want to do, but at the end of the day, what you need to understand is that why you're getting, what are the factors which can cause back pain. If you can address all of these things together, and if you understood what I've told you before, then you will get your answers. Okay, so people do say that, I go to a chiropractor and he adjusts me, or you go to an osteopath and he does something and you feel good, or I do a massage and I feel good. Because see, if only massage or if acupuncture was going to make you better, then people like us would not exist. We would not need spinal surgeons. Okay, we would not need pain consultants to do injections. There was no need for us to be available, because if only massage was going to go there, NHS would only get masseuses in the house and they would just get everyone to get a massage done. All these are temporary reliefs. Remember, Okay, it is not going to address the root cause. The root cause will only be addressed if you work on treating yourself in all the possible aspects of back pain, which is exercise for muscles and everything, movement for that. Then if there is any psychosocial factor, agar tamne magajma kai stress che ke kai che, enu pan tame agar you start doing some mindfulness and everything. So when every aspect of back pain is put together and done, then you will start seeing that you're getting better. Okay, now this is very, very important. Back pain ma usually dekhaય nahi, but people with back and leg pain ema dekhaય. But agar tamne back pain na sathe kyare પણ આમ થાય કે you've lost control of your bowel and bladder control. Okay, તમારી જે પેશાબ કરવાની જે ક્ષમતા છે કે તમને સંડાસ કરવાની જે ક્ષમતા છે તમારા હાથમાં નથી, એ આપોઆપ થઈ જાય છે. Or you lose sensation, તમને હાથ લગાવો તો ખબર નહીં પડે around your genitals. Okay, કે તમે બંને પગમાં તમને સખત એકદમ sharp shooting pain થાય છે અને numbness થાય છે. તમે ચાલો છો અને પડી જાઓ છો because of numbness in the legs. Then you have to attend the A&E, that you have to go to the accident and emergency. People who can read Gujarati should read this part of it. એમાં એ લોકો સમજાવે છે કે શું કરવું જોઈએ when you get these kind of symptoms. But these are something these are few symptoms which you need to be aware of. Agar tamne kamar ma dukhe che and you've got leg pain, you've got back pain with leg pain, both leg, and suddenly you stop passing toilet, okay, or you suddenly have changes in control of urine, you wee in your pants or something of that sort, you should attend the A&E immediately. That's a sign of something serious, which is called compression. એટલે તમારા નસ ઉપર આખું પ્રેશર આવી જાય. Now, what should I do? This is key. Now, this is where I want everyone to be very attentive. I'm sure you all have been attentive before, but this is very, very important. Now, this what we're talking about is someone who's got an acute episode of back pain, okay, even chronic for time, it can be applied. But my whole thing for today was to let you all know that how can you manage your pain on your own? Okay, so if you understood these 10 points which I've told you, that don't worry, this is nothing nasty, you've not broken anything unless you had a trauma or something. If you've not had trauma, if you've just bent down and you picked up something and you've got back pain, don't worry, there's nothing serious. Or gradually your pain came, if you're old and the pain is coming up, okay, with age you kept getting it, then it is for all those people. My first advice is, as I said, movement is medicine. Okay, be active, be on the move as much as you can. The recommendation is, okay, we should exercise at least 150 minutes at moderate levels or 75 minutes at vigorous level. Okay, this is for the I think up to 65 years of age or 70 years of age. In my opinion, everyone can do within their capacity. Okay, but if you want to prevent back pain, then you should try to be at least active 150 minutes at moderate intensity. Agar tamne pain che, then also I would suggest that try to be as active as you can. Move within your capacity. Okay, at home, start doing simple movements. Simple movements are like what? As I can, let me explain you. I don't know if you all can see me. Simple movements would be what? You can be at home and you can just try to gently bend forward and backward. Bend forward and backward. You could just do some marching. Okay, then you could hold a chair and you can go down and up. You can go down and up. Okay, so, or you can sit on the chair. You can sit on the chair and stand up and sit down. You can start with doing only one movement and then build it up to 10, 15, 20. As I said, work within your capacity, but be on the go, be on the move. The more you move, the better you're going to feel, the quicker you're going to get better. Okay, as I said, take painkillers only if it is needed, and consult your GP or your pharmacist, whoever. I always suggest to all my patients who are in a very bad pain, okay, very severe pain, acute severe pain, try to walk for 5 minutes every 3 to 4 hours. Try to do every 2 hours, 3 hours, as much as you can. Okay, do, as I said, do a sit to stand or something of that sort, but try to be as active as you can within your limits. Now, very important with back pain, everyone should know, You will have good days, bad days, and worse days. This is natural. This is normal. With any musculoskeletal issue, you can get some days are very good, or some days I feel nothing, but some days I feel so bad. I can't bear the pain or nothing. But that's how it behaves. So if it's a worse day, try to go around it, work around it. But if it is a good day, then try to exercise and do as much as you can. There's a lot of help available online, which is, this is one of the websites which I've put. But if you just type back pain, lower back pain, NHS exercise, you get multiple things which are there. Okay, I always say, for if you have back pain, try to engage in activities which take your complete attention. What it does, it takes that signal of pain away. As I said, this is a complex structure. Your brain, how you think about your pain is very important. How do you perceive your pain is important. Okay, if someone said something, and if you have that in your head, and if you start believing it in and out, then you will start getting aches and pains at even simple activities. So have control on your thoughts, and hence I keep saying that engage yourself into something which can take your complete attention. તમે આવું કઈ કરો જેમાં તમારું આખું attention લાગે, તો તમે દુખાવાને ભૂલી જશો, ભલે 1-2 કલાક માટે, but that is also healthy. The more that sensation is taken away, the more you are going towards recovery. Okay, now just a quick note which I wanted to put here, because there's COVID and we have to follow the guidance. It's important, stay safe, stay home. I wanted to tell you a few quick things for people who are working from home, or everyone. We are all homebound, especially first for visual display unit users. If you have if you're working on a laptop or a phone or something, make sure that you look after your posture. By posture, I don't mean that this is the best posture or this is the best posture. Okay, any posture you take is okay, but you have to keep changing it. Okay, the point being, if I pull this finger behind, આને અગર હું પાછળ કરું તો હવે મને દુખે છે, તો હવે આ દુખે છે, તો આને હું to take away the pain, what should I do? મારે દુખાવો નથી જોઈએ તો શું કરું? આ કાઢી દઉં. Okay, the same way, if I'm sitting like this અને મને અગર દુખે છે કમરમાં, તો I have to change the posture. So you have to frequently change your posture. It's very important. I suggest every half an hour તમે get up, take a break, move, sit down again. Okay, exercise while you're working. Sometimes when we are in clinic and we are on virtual consultations, or we are talking to patients on the phone, I will tend to do, with my headset on, I will try to do some exercise. I'll do some squats, I'll do some bending, front and back. So try to exercise. Do every 2 hours, do 5 push-ups or something, whatever you want to do. If you're working from home, you are sat on a chair for a very long time, it's important that you try to exercise within that working period, because common excuse badani શું હોય, time નથી મળતો, I'm not able to exercise because I don't have the time. But you have to find some time, and the best time is try to do bit by bit in between your work, which also helps to take breaks. Then when you are on a phone call, if your job demands a lot of talking, even ઘરે બધાને તમે ઘરે તમારા છોકરાઓ સાથે વાત કરો છો, or if you're talking to your friends, colleagues, anything, keep the phone on and keep walking. Whenever you're talking, keep walking. You will not realize that you've spoken to someone. ક્યારે ક્યારે આપણે ઘરે બેસીને અડધો 1 કલાક કોઈના સાથે વાત કરીએ, but imagine at the same time, if you were walking, it would have taken at least that 60 minutes of walking from that 150 minutes of exercise which you have to do. Does that make sense? So I hope these are good tips which you can take. And very, very important, this is for all age group. I don't think that the oldies cannot do this, કે તમે 80 વર્ષના થઈ ગયા તો તમે નહીં કરી શકો. તમે એક સ્ટેપ્સ નો ટાર્ગેટ રાખવાનો કે હું દિવસમાં 5000 સ્ટેપ તો ચાલીશ. Okay, or I'm going to walk 8000 steps, or I'm going to walk 10,000 steps. It's important. જ્યારે પણ કોઈ પણ આ બહુ કોમન છે હ્યુમન્સ માટે. For any human, when he is given a target, most of the humans, not any, sorry, most of us, ક્યારે તમને આમ કઈ અચીવ કરવાનું આપ્યું હોય ને કે you have to achieve this, then you try to do it. Okay, so have your chart somewhere of exercise. You try to put a chart on which you can tick that Monday I've done the exercise, Tuesday I did my exercise, Wednesday I did, and every week you would want to see a tick, tick, tick. You could just print something like this, okay, and just keep ticking. And when you keep ticking, it will make you feel good, and you would want to have that tick every day. And for that, you will at least do some exercise. Okay, don't cheat, be true to yourself, but exercise as much as you can. Whatever motivates you. Okay, if this talk motivates you, if using a calendar motivates you, if whatever, but you need to find something which can get you going. And I'm happy with anything which can get you going. This is where I've taken all my stuff from. And before I end, I just want to tell you one thing. There's a very important principle which I keep telling all my patients is load capacity mismatch. Okay, body માં શું હોય, તમારા જેબમાં અગર 10 રૂપિયા છે ને, તમે ટેસ્કોમાં જઈને 20 રૂપિયાનું સામાન નહીં ખરીદી શકો. If you've got 10 pounds in your pocket, you can't buy stuff worth 20 pounds. Okay, so it is important that you understand this capacity of yours. So if you have only 10 pounds worth energy in the body, you can work your body only within that. તમારે એની capacity પછી થોડી રીતે વધારવી પડે. So once the capacity increases, then you will be able to do 20 pounds નું કામ. સમજ્યા? Because patients come to me and say, અરે મારે તો 5 કિલોમીટર 10 કિલોમીટર ચાલુ છું તો મને દુખે છે. પણ તમે 5 કિલોમીટર ચાલવા કેવી રીતે શરૂ કર્યું એક દિવસમાં? That's not going to work. You have to build it up. પહેલીથી 10વીમાં જે છોકરો જાય he cannot pass grade 1 and go straight to class 10. You have to go through that stage, and that's exactly what is important. You have to understand and be patient with yourself. You will see results. You will start feeling better. There is no quick fix. मैं आज आ करूँ and it's going to get better. It's not going to happen. Okay, there is no quick fix for back pain. There is no shortcut. Believe me, there is no shortcut. You have to work yourself, and anything which you do, ultimately, it is all going to come to what exercise and movement. Believe me, wherever you go, whatever you do, at the end of the day, what it is going to come to is this. With that, I know I've just gone overboard, but thank you for listening to me, and I'm happy to take some questions, and I hope you all got some key messages here. Anaben, over to you.
Thank you very much, Suraj Bhai. It was very, very informative. I'm sure everybody has digested, and it was fairly easy to understand you as well. But we are bombarded with questions, which I hope Jyotiben is going to help me with this. And I've got at least 15 questions written down. Jyotiben, would you like to start off?
Yeah, thank you very much, Navin. Suraj Bhai, excellent presentation, very, very well done. Kubaj simple, easy to understand language, and very practical tips to bada samjhi sake. So thank you very much. And a nice mixture of both Gujarati and English. So
I tried.
So very well done. I've heard you before and I know you're excellent. So thank you very much. I just want to say one thing. તમે જે સુરેશભાઈની એક્સરસાઇઝ જોઈ છે ને ઓલી ખુરશી પર એ છે ને પૈંડાવાળી ખુરશી છે એટલે એક વસ્તુ તમે ઘરે એવી ખુરશી પર એક્સરસાઇઝ નહીં કરતા નહીં તો you go flying. So find a static chair to do those exercises. So Surajbhai, lots and lots of questions. A lot around back pain, but actually I'm going to start with one very practical question. What is the correct way of lifting?
There is no correct. Sorry.
Tame batavi sako?
Yes.
Do a demonstration.
There is no correct way of lifting. Okay, as I was explaining, આવું નથી કે આ રીતે કે આ એક પેટર્ન છે કે આટલા એંગલ પર તમે ઝૂકીને આટલા એંગલ પર કરી શકો આવું કાંઈ નથી. Okay, this is a myth. You have to let your body free and do the way you can do. Okay, હવે it is very important કે mainly what happens is જ્યારે કોઈને back pain થાય ના ત્યારે when they bend forward it keeps aggravating the pain. એમનો દુખાવો વધતો જાય. Now in that case what I would suggest is કે અગર તમારું pain both સખત દુખે છે અને સખત વધે છે because of bending down, then that is the point when you have to be careful with what you are doing. But otherwise there is no one fixed way that there is commonly what I see is that they say that you go straight and you keep your back straight and go. There is nothing of that sort. Okay, you can go as freely as you can. You can try to go just in a natural way what you can and what your body can take. Your body will tell you. You will learn. તમે તમારા body ના તમને કહેશે how to move and what to move and which way to go. So there is no one fixed way. Yes, when it comes to people like pregnant ladies and all, when there is a repetitive movement, कोई अगर repetitive काम करे छे, continuously he has to bend again and again, then they are the people who they don't have to concentrate on how to bend. What they need to do is again 10 રૂપિયાની શક્તિ છે જેબમાં, તમે 20 રૂપિયાનું કામ કરશો તો નહીં ચાલશે. તો તો તમારે એ capacity વધારવી પડશે. So bending whichever way, but if you work on strengthening your muscles, okay, તમે અગર એની શક્તિ વધારો exercise કરીને, then you will be fine.
So that's an excellent answer. Thank you, Suraj bhai. Bijay કોઈ કે પૂછ્યું છે, is there a connection between back pain and hip pain?
Yes. So back pain and hip pain can be either two different things or they can be connected also. Yes. So as I was explaining starting ma, ke je tamara aaj manka che, okay, in this do you see these nerves coming out? Aaj naso che, હવે આ નસો જે છે ને આ પાછળથી શરૂ થાય and they run down into your legs, okay. So sometimes your back pain can also refer pain into your bottom, okay, into your thigh, into your PD, a calf, or into your ankle or toes, okay. So yes, back pain and hip pain can be related to each other. So your hip pain can sometimes be coming from the back pain. But hip pain ma dhyan rakhwanu, if you're talking about pain in the front of the hip, if you're talking about pain here, okay, in the groin, that is very unlikely to be from the back. But if you're talking about back pain which is going down into your glutes, okay, our region ma ke anya, then it is very common to see that with back pain, okay. So the best thing, you know, which is not very you know, common, but remember, back pain hoye ke hip pain hoye, agar it is just started, you know, initially, the answer is still the same, which is exercise and movement. Don't worry too much about it. But yes, if you've had it for a long time, then you need to understand that where it's coming. So the answer is to that is very simple. Yes, that it can be related.
So there's a recurring theme on lower back pain here, saying rheumatoid arthritis, does that affect back pain or does that cause back pain?
Now, rheumatoid arthritis is a systemic condition, okay. એ તમારા system ની એની જે એમાં whenever someone has got rheumatism or rheumatoid arthritis, okay, એના major symptoms હોય હાથમાં નાના joints માં હોય, okay, and it is mostly bilateral, જેને rheumatoid arthritis હોય. But એના સાથે what we commonly see is inflammatory back pain, જેને શું કહેવાય, in medical terms we say inflammatory back pain. What it means is કે તમને રેસ્ટ માં તમારો દુખાવો વધી જાય અને મૂવમેન્ટ માં તમને થોડું થોડું સારું લાગે. But that is possibly one of the ways it presents, okay. એ બહુ મોટી, it is a complete different entity. I cannot talk in details, but yes, rheumatism માં કે rheumatoid arthritis હોય તો તમને back pain હોઈ શકે. It may or may not be, you can have pain because of rheumatoid arthritis, but you can have rheumatoid arthritis and separate mechanical back pain, je aje apne discuss karyu, okay. It is not always that if someone has got rheumatism, that means 100% કે મને અગર rheumatoid arthritis છે એટલે મારો દુખાવો આ કમરનો પણ rheumatoid arthritis નો છે, આવું નથી, okay. You can have either two separate things કે બંને સેમ પણ હોઈ શકે. But એના માટે તમારા જે પણ physiotherapist હોય કે GP હોય, they can run some tests to understand કે શું છે અને you know what it is.
That's brilliant. Thank you, Suraj bhai. Very, very good explanations and very practical. Thank you. There's a couple of things that Koike Puchuche, just to get some clarification on. What is the meaning of a bulging disc?
Yeah. So now,
model matame batavi sako ne?
Yes. Now that's, you know, I'm glad this question's come up, because what I want to do is quickly, I've broken my spine. My spine મેં તોડીને હાથમાં લઈ લીધી છે. This is better. Okay. Now આ મણકો છે તમારો. આ સમજો કે L4 L5 છે. આ આગળનું ભાગ, okay, you're facing this way. If I am like this is my spine, okay. Now you are seeing from the left side, I am seeing from the right side. This is front and this is back. These are the two bones. વચ્ચે છે disc, okay. આ જે ગાદી છે ના, now this has the capacity to, you know, whatever means all those movement, disc bulge ke protrusion, એ બધું અહીંયા થાય આના ઉપર. Now આમાં શું થઈ શકે કે આ જે ગાદી છે, okay, it can bulge out, but what it means is that it can bulge from here. It is simple. જે તમે ફુગ્ગો લો અને ફુગ્ગો ક્યારે ખબર છે એક જગ્યાથી મોટો થઈ જાય, when you are blowing it, at the end it is, you know, slightly bigger. The same way here, it is just going to bulge. It literally means bulge, but there is no literal bulging happening. જે લોકો કહીએ ને કે ડિસ્ક બલ્જ થઈ ગઈ મારી, કે ડિસ્ક પ્રોટ્રુસ થઈ ગઈ, કે મારી ડિસ્ક સ્લિપ થઈ ગઈ, there is no literal thing which is happening here. That happens in a very very few cases. એ બધાએ ध्यान રાખવું બહુ જરૂરી છે. મને સ્લિપ ડિસ્ક થઈ ગઈ, મારી ડિસ્ક સરકી ગઈ છે, it cannot. આ જે મૂવમેન્ટ્સ જે આપણે વાત કરીએ છીએ ને બલ્જની અને પ્રોટ્રુઝનની, કે આ બધાની, એ મિલીમીટર્સમાં છે, મિલીમીટર્સમાં એકદમ નાનું મૂવમેન્ટ હોય છે. ઇટ ઇઝ નોટ કે અહીંયાથી બહાર આવી ગઈ અને યુ સ્ટાર્ટ ફીલિંગ કે આઈ કેન ફીલ કે મારી ગાદી બહાર આવી ગઈ છે, આવું નથી થતું. Okay, so it's in millimeters. So bulge happens is here. If I can quickly share my screen and show you a bulge, because it's there on the PowerPoint. Just 1 second, Jyotiben. I think everybody can see. This is, this is where, what we are talking about, like a bulge or a protrusion. So this is something more than a bulge or protrusion, but this is where the disc can come out. Okay, this is the commonest region where it can come out, and that's where you can get. So that's what it is, a disc bulge. But believe me, if it is disc bulge or disc protrusion, it has got nothing to do. It is not going to change your management strategy. Your answer still remains: movement is medicine. You have to exercise. That is your answer. MRI પર જોઈને તમે કહેશો અરે મને બલ્જ છે, પણ એ બલ્જનું કાંઈ ઇમ્પોર્ટન્સ નથી જ્યાં સુધી it is causing a severe compression on the nerve. નર્વના ઉપર એ ટચ કરશે અને એના ઉપર સિવિયર કોમ્પ્રેશન કરશે ને, તો એના એ અલગ સિમ્પટમ્સ આખા તમને આપશે, અને એના અંદર એ બધું ઇઝ ઇમ્પોર્ટન્ટ. અધરવાઇઝ આ બધા જેમ તમારી ઝુરીઓ થાય ને, the same way you are getting bulging, it is very common. હવે તમને સફેદ બાલ આવી ગયા, તો હવે તમે એને કાલા કરવા હોય તો બ્લીચ કલર કરી શકીએ, but we can't change it from the root. The same way these changes everybody is going to get. Everyone's going to have disc bulge and disc protrusion, all these things. It is very common.
And the answer is really to keep moving, isn't it?
Don't worry about, don't go. જે રેડિયોલોજીકલ જે ડાયગ્નોસિસ હોય ને, એ તમે ક્યારે પણ રેડિયોલોજીની કોઈની રિપોર્ટ પણ જોશો ને, અગર રેડિયોલોજીસ્ટની તમે MRI જોશો, એમાં છેલ્લે લખેલું હશે કે કાઇન્ડલી કોરિલેટ ક્લિનિકલી. ઓકે, રેડિયોલોજીસ્ટ એનું કામ છે એ જોઈને એ કહે છે ઇટ્સ અ બ્લેક એન્ડ વ્હાઇટ, ઇટ્સ અ સ્કેન. હિઝ જોબ ઇઝ ટુ રિપોર્ટ કે ભાઈ મેં આ જોયું, મેં આ જોયું. But it comes to people like us, to your GP, અમે લોકો એ રિપોર્ટને અને પેશન્ટને બંને સાથે રાખીને we can give you an answer કે see, I've seen your report, I've seen you, this is what is happening. So go to your GP, your physio or someone, and they can guide you the best way.
Excellent answer, thank you. હવે ઘણા જણે અલગ સવાલ પૂછ્યા છે, but the theme is the same, which is about treatments and cure for back pain. So કોઈ પૂછ્યું છે, is there, I'm going to put them all together for you, Suraj bhai. Is there a cure for back pain? પછી બીજા કોઈ પૂછ્યું છે, આયુર્વેદિક ઓઇલ્સ જે આવે છે ને, નવરત્ન ને ધરનસા, એમાંથી કઈ ફરક પડે, અથવા તો does yoga help to reduce back pain? So what's your impression of all these different treatments that are available?
Now, as I said, back pain nu સૌથી પહેલા you have to understand that it is multifactorial. Okay, now multifactorial એટલે શું કે એના બહુ કોઝિસ હોઈ શકે છે. As I said કે અમે લોકો મેડિકલ વર્લ્ડમાં we say that it is biopsychosocial. એટલે શું? બાયોલોજીકલ એટલે સ્ટ્રક્ચર. તમારા મણકામાં કઈ છે, એમાં કઈ તકલીફ છે, તમારા સ્નાયુમાં શક્તિ કમ થઈ ગઈ છે, કે તમારા કઈ તો બોડીના અંદર, એને કહેવાય બાયોલોજીકલ. સાયકોલોજીકલ એટલે તમારા મગજમાં. How do you perceive back pain? તમને કોઈએ શું કીધું છે કે ભાઈ તું ઝૂકશે અને દુખશે, તો પછી ઝૂકશો તો દુખશે જ, એનું કઈ બીજું ઓપ્શન જ નથી. ઓકે, સો how do you perceive pain is also important. અને social, અગર તમને બહુ સ્ટ્રેસ છે અને એ બધું છે, as I was explaining in the previous slide. So when you address, you have to really understand કે આ બધી રીતે you have to address. It can be કે એક component વધારે હોય અને બીજાનું કમ હોય, but it can all affect each other. Okay, that is the most important thing. Now, treatment ma what is needed is you try to address these issues. First, identify ke mane kai avu chhe ke nathi. If it is there, then yes, you need to work on it. Now, the most important treatment still remains is exercise, movement, strengthen your muscles, do exercise in standing. સુઈને તમે પગ ઉપર નીચે કરો છો, કસરત કરું છું, everybody comes and tells me હું સુઈને બધું કરું છું, but તમે ચાલો છો અને ઊભા થાઓ છો ત્યારે you are getting pain. When you are walking and standing, you are getting back pain, and you are exercising in lying down. There is no, it does not convince me. So if you have pain in standing and walking, you should try to do the same movement and train your body to do that movement, okay? And that is what is going to make you better. So exercising is important, but exercising the right way is important, okay? Now, I say that any kind of exercise is okay. You can do, you can go for a walk, you can go for a swim, you can do, exercises just at home, you can do floor exercise, you can do yoga exercise, anything which helps to keep you moving and getting stronger. Gradually, જે 10 રૂપિયા છે જેબમાં એ અને કામ 20 નું કરવાનું છે. You have to understand, if I've got 10 pounds in my pocket, 10 pounds the energy chair, but I'm trying to every day do work of 20 pounds, it's not going to work. So our deficit ne tamare clear karvu che. For that, exercise is the answer. Okay. Oil and everything is all temporary. In my opinion, it's all in the brain. It's all placebo. It makes you feel good. Yes, I'm not denying. તમે acupuncture કરશો કે કઈ ઠંડુ શેક કરશો કે ગરમ શેક કરશો, you will feel good, but it's temporary. It is not the root cause treatment. Okay, so you have to understand that all these other things which you do is all going to help you a little bit, but the ultimate answer for everything will come down to movement and active and just trying to work as a whole, and all those other factors, healthy lifestyle, sleeping, all those things we spoke.
So Suraj bhai, એ બધા juda treatments માં કઈ ઓલા back brace આવે છે ને? Is there a role for wearing a back brace?
Yeah, now you have to understand, Jim, I was trying to explain in the beginning, okay, back brace is exactly how you have your muscles. So you have your own brace. Our corset, you've got muscles in the front, you've got muscles in the side, you've got muscles on behind. You already have a corset, you already have a brace in your body, okay? Why would you wear something external and આ brace નું કામ પોતે બંધ કરી દેશે? Okay, if I am working in let's say in a shop, મારા અંદર અગર તમે મને 5 માણસ આપી દેશો તો હું તો lazy થઈ જઈશ. I will stop doing my work, or I'll forget what, I'll not be as efficient. The same way, if you start using anything external, okay, તમે support આપવાનું શરૂ કરો, then your muscles are going to further decondition. They will stop doing their job because કોઈ બીજું એનું કામ કરે છે તો સૂઈ જશે. એ સુએ છે એ માટે તમને દુખે છે, but if you then do something external, it is going to further go off and it's not going to work. I don't recommend for anything which is mild to moderate, okay? अगर तुमने severe pain पण છે, I would not really recommend, but if you do something specific, like you've got your orthopedic surgeon has told you, or your spinal surgeon has told you for some time to use it, then please take their advice and go ahead and do it. But for general back pain, for acute, just for routine back pain which you get, do not wear a corset or a brace or anything. It is not doing any good. It is only going to do, most likely it is not going to help you with anything.
So Suraj bhai, અત્યારે obviously આપણે બધા પાછા બીજા લોકડાઉન માં આવી ગયા છે, એટલે કોઈ બહાર સ્વિમિંગ કરવા તો નથી જઈ શકતા. So હવે ઘરે રહેવાનું કીધું છે બધાને. So can you show a couple of exercises that people can do at home for their back, for lower back pain specifically?
Yeah.
If you don't mind. Thank you.
As I demonstrated before, I'm going to, my quick go-to exercises for, means if you see my track record for all my patients, most commonly who I exercises are put you and they work, okay? First is try to be active, okay? Try to have every 2 hour, 5 minutes walk, 10 minutes walk, okay? Now, the other thing which you can do is in the day, if you're sitting on the chair, if it is too painful, bring your chair up, okay? Put some pillows or sit on a higher bed or something, and then you could do simple thing is stand up, sit down, stand up, sit down. That's the first exercise.
Not on a wheelie chair.
Not on a wheelie chair, but sometimes for people it can also help to further increase the, because it's challenging. But if you have a balance issue, then don't be on a wheelie chair. But if you don't have a balance issue, then it's okay. It is going to challenge you because the more, the base is moving, the more stronger you're going to get. It is just going to build up more strength. So that's the first exercise. You can just get up and sit down. You want to make this challenging, decrease your height, go down further, and then come up. It will require further more efforts to do. Okay. So
Suraj bhai, I'm just going to interrupt you there. હવે કોઈને આવી exercises ઘરે જો કરવી હોય ને, તો how many repetitions do you recommend? So how many times during the day, and the frequency?
Now, you should try to do them at least, 10 to 15 times each time, okay? And try to do at least 2 to 3 sets of that exercise. So you're doing 10 to 15 repetition and 2 to 3 sets. Now, this cannot be a fixed number for everyone. If your pain is too much and you are in a lot of pain, you might be able to do only 1 repetition. I'm happy with it. Do that 1 every 2 hours, okay? If you are in a lot of pain or moderate pain and you can do only, I do 5 times and then my pain increases. Okay, you do only 4 times, but keep doing it every 2-3 hours. Maybe 2 weeks later, pachi tame 4 na badle tame 6 વાર કરી શકશો. So you have to gradually build up your exercise. જેમ મેં કીધું પહેલી ક્લાસ થી તમે 10મી ક્લાસમાં ડાયરેક્ટ નહીં જઈ શકો. So what you should do is you should start with, see how many you can do. I can do 5 today. Stick to 5. Do 3, 1 set, 2 set, 3 set, how many ever you can, and then keep building up on it. Okay. If you are able to do a good amount of exercise, then I recommend that for each exercise, try to do 2 to 3 sets and at least once a day and 5 days a week. And remember, you have to keep challenging. તમે જે પણ કરીને તમારી challenge વધારી શકો, that is important. Away, coming back to this exercise, Jim, I was just doing sit to stand. I can also put a, to make it further challenging, because we are not going out. હવે ઘરથી આપણે બહાર નથી જતા, exercise કરવા જીમમાં નથી જતા, કાઈ નહીં. You can just wear a sack, put some books in it, and that will add some resistance to you, and you will stand up and sit down. So હમણાં તમે body weight કરતા હતા, હવે body weight plus 5 kgs weight you will do, whatever you put in your sack. That's your first exercise. Okay. Second exercise, I always tell them, if you can, you should start bending sooner. It is very important. તમે જેટલું bend કરી શકો છો. If I can go till here, I'll just keep doing that. I'll go and I'll do that. Okay. Or very commonly what I tell them is try to put something from one position to other. So this is my chair here. I'm taking a book from here and I'm putting it here. In this one movement, I'm doing a lot of movements which are helping my back, which is bending, squatting, everything together. So do functional. That is the second exercise. So second exercise was, in any way, try to bend. If you can bend so much, okay. Little more, okay. You can bend completely, then try to get some weight in your hand. Hold some weight and then go down and come up. Go down and come up. That's the second. Third exercise is, you can try to do a squat, first supported, so get again a stable chair, or you can hold on to the wall. So just hold your hands onto the wall and just go down and come up. And again, the range is what you can do. There is no that you have to go so deep, or should I go completely down, or should I be, halfway. Go to the point you can and come up. Okay. These are my
Suraj
3.
Bhai,
Yes.
Suraj Bhai, at that point, somebody has just pointed out that you were wrong. Hold on, it's moved.
So I think Pannaben, કોઈકે યોગાને માટે question પૂછ્યો હતો.
Oh, right, okay.
યોગામાં એમ કહે છે કે you need stability, not mobility. So I think this is a difference between, obviously, physiotherapists માં તો એ લોકો mobile જ કરવાના છે ને, if I'm not wrong, Suraj
No,
Bhai.
he's saying you can't stand up and sit down and think it will resolve any pain. Your lumbar needs stability, not mobility.
Well, with due respect to the person who's written, I completely respect you and what you do. But again, these are movements and exercises just to get you going. I'm not saying that this is what is going to take your pain away. This is one exercise you do and you're going to get better. That's not the message which we're giving here. The message is the whole talk, what we've spoken. There are a lot of factors which you need to look into and then address yourself, okay? But I do not agree that this is the right way of bending or the wrong way of bending. There is no right or wrong way of bending. You can bend whichever way you want to, but you have to work within your limits. If you think that bending is giving you pain, and if it is too much, unbearable, excruciating, you may want to avoid it for a while. But anything, your lifestyle is everything which involves bending. Can you do any work which is going backward? It's all forward bending, okay? So if you're going to be so cautious, 80% of the time what you do in the day is bending. So you are going to keep going, doing that. So again, remember, I am not saying that this one exercise or anything which I said, that one exercise or that one thing which you take from this, slides is going to treat you. It's a holistic approach. It is a holistic approach. You have to exercise, you have to do multiple things to get yourself better.
No, that's a great answer. Thank you very much, Suraj bhai. The તમને ખબર છે સૂર્ય નમસ્કાર exercise શું છે?
Yes.
So do you recommend that?
Yes, you can do that. That is also a good exercise.
So
And,
my ignorance, મને તો નથી ખબર આ શું છે. Can you perhaps explain it to the audience? કે આનો મતલબ શું છે?
I think it will be difficult to demonstrate, but Surya Namaskar is basically, yeah, it is a movement and it would help you to, it is basically you stand up, you bend down, you are, stretching head. So it's a lot of movement. It's a combined exercise. It's one exercise, it's one movement with a lot of activity in it, which makes you work, makes your, a lot of muscles work in the body. And that is what is going to, it is beneficial. Okay. You can do it. In that also, if you see, you are going to, it starts with standing up, then you bend down, you are going to the floor, then you stretch ahead, you're going in something called as Bhujangasana, the cobra pose, then you come back. So basically it's a lot of mobility in the spine, also with a lot of, because you're going to be holding yourself, so there's a lot of strength also which is going to come. So it's a good exercise. Yes, if you're doing that, continue to do that. There is nothing, there is no right or wrong answer. Any form of exercise is good exercise. As long as you're exercising and working on that, it is fine.
So that's brilliant. I think there's a lot of people saying Emma Barjatna exercises આવે છે, or 12 poses.
Yes, I'm not a specialist of that. I would not know. Yes, I'm not the best person to comment on that. Maybe someone who deals in yoga can tell you exactly. But for me, I look at it as a movement. Okay. Yeah. For me, it's a good movement. You do it whichever way. I am not fussy about bend this way, bend that way, keep your knees like this, keep your knees like that. Unless it's really, going to be, out of your way, then otherwise I'm okay.
So quite a few people have also commented on sciatica. So sciatica માટે તમે કયું exercise recommend કરો છો? Or is there a plan of physiotherapy for sciatica type pain?
Now, again, as I said, one exercise is not the answer for anything. Just let me be clear again. I don't want someone to take this as that this is one exercise. As I said, there is no shortcut. There is no that if I do one, I'm going to get better, or this is the best exercise. It's a lot of things which influence your condition to make you better. Remember, okay? Now, sciatica. Now, in sciatica, remember what is happening is your nerves getting irritated. Okay, that's why you're getting that irritation, and that's why the pain's going down your leg. Okay, it's a complete different subject to be spoken about. It's a long topic to discuss, but in terms of exercise wise, okay, it is still going to remain the same. But there's also some evidence to support if you do nerve gliding exercises. Okay, nerve gliding is basically trying to move the nerve, and that can also help you to get some results. But if you ask me about exercises, will it really change in terms of sciatica? It is still going to be the same. Okay, you still need to work on this core muscles here, you need to work on your leg muscles, and you have to keep doing the same thing. There is nothing which specifically changes. What can possibly change is the irritability can be sometimes very high, and those patients cannot do a lot, and hence they might have to cut down on the intensity and gradually build up. But the only other thing which we can add there is sometimes nerve gliding exercises. Yes.
So, you talked about core strengths to help with, and your own natural core set. So, are there any specific exercises you can recommend to help with core strength?
See, now on this, there are two different schools of thoughts. Some people believe that you need to do specific core exercise to work on the core. Okay, and there is another school of thought where what we say is that any exercise you do, this is the stability. It is going to get stabilized first. For any movement you do in the body, you need to have stability here. If you don't have stability here, you cannot. So each form of these exercises, which I told you, even just doing a squat up and down, sit to stand, okay, just doing, let's say you do a lunge, or any form of this exercise also is still going to activate the core. But it depends on what level of activation you're doing. Okay, now there are few very specific core exercises like planks, like side planks. Okay, then you can have Superman. There are multiple those kind of exercises also, but you have to remember that you have to work within your capacity. Now I am talking to to a forum where I have people from different age group. Okay, so I have to be very careful of who does what. Okay, so you select for yourself. If you can do, please go ahead and do. As I said, for me, what I need is you need to just work on strengthening and building up your capacity. That's what you need.
So no, that's very useful because sciatica to both common and they always end up going for the anti-inflammatory medications.
Yes,
So
yes.
this is much more useful.
Yes. So with sciatica, sometimes what happens is the pain is so excruciating and unbearable, and because it's the nerve is a little more knottier than any other structure in the body, and that can really, it can put you to tears. Now, for those patients, sometimes, because see, I am saying that again and again, you need to exercise and move. But if you cannot exercise or move because of pain, then you need to address this pain first. Then what I'm saying is not going to make any sense, because I need to calm the pain down to allow me to exercise. So when you are in such a situation, when you cannot exercise because of the high level of pains, that's when the role of medication is going to come into picture. Okay, that's when you need medication. Now, for sciatica, yes, there are different stages of medication which you might take. Okay, right from painkillers to anti-inflammatories to opioids, from weak to strong. Then you can go to something very specific. I don't know if someone taking an anti-neuropathic medication. Okay, when the pain is really bad and you have to take a pregabalin or a gabapentin. Again, I am not an expert to advise you on that, but you can talk to a GP. We only recommend the GP or the pharmacist to tell you, to advise you on that. So yes, there is medications to calm the pain down. Then if the pain is better, then you can start exercising, and then that is going to help you to get better.
I know somebody in chat Marco recommend ice pack for sciatica pain.
Consultant is you.
Can I please request के audience मतलब मैं mute पर जाता रहूँ, so आप सूरज भाई no advice somebody सकिए. Thank you. Sorry, Suraj bhai. So what someone has recommended ice packs for sciatica type pain.
Now, see, ice pack is only going to work to numb the pain, okay? But it's not for sciatica pain. Means where all are you going to, put the ice pack? Sciatica pain is the pain running right from the bottom of the back going down to your leg, okay? Now, if you are doing something and if it's making you better and if there is no adverse effect of it, please go ahead and do it. I am not a big, I don't know the right word, but saying that, you do this or you do that. My point is, as long as there is no side effect, and it's not causing a big hole in the pocket, then go ahead and do it. It's your decision at the end of the day. Okay, we can only advise. But the point is, icing is only going to numb the pain. It's going to make you feel good for a while. It's not treating your pain. That pain is going to, get better eventually on its own. If it does not, that's when the role of GP or your pharmacist or a physiotherapist or someone is going to come into picture. So initially, all these conditions, bear in mind, are all self-limiting. They have their own time frame. They're going to get better. Okay, you do this or you do that. But to promote it to get better, these are the things which you can do to help it to get further better, quicker. Okay.
No, that's brilliant. Thank you. Your advice has been so practical, Suraj bhai. It's very good. And Panna bin mari paase to wo bija questions chair. I'm quite happy to carry on, but I don't know if tamari paase kadach hoi koi puchwano.
I've got one of our regulars who's actually said, please specify this. So can I just mention this? It's a question in advance for a lady with severe back problem with bulging disc. I think Suraj Bhai has already mentioned this. What she's saying is below is a brief summary of a condition. She'll be in the session, but want to stay anonymous. She's saying, I'm 62-year-old female and have a long-term back problem. This restricts me from walking and standing or even for a few minutes. I have to stop to take rest for a while after walking for 50 meters or 60 meters. My back seizes up and becomes very tight. I am overweight and have a lot of abdominal fat, not obese, and suffer from type 2 diabetes, but on insulin. I have been referred for stomach surgery, but to reduce my weight and to help her back. How can you advise her?
Well, we have to address this as a case, and for that, we'll have to maybe take it offline, and I'm happy to help her, offline if she can contact me. But just taking for the general population, for the advantage of everyone, what I'm going to pick from there is she's got disc bulge and she's got pain after, walking for 5 minutes, she said she gets. Yeah. Now, again, I don't know the whole case. Okay, I need to know everything in detail to understand what's happening, and then only I can comment. But just for the sake of understanding for everyone, sometimes you can get this, and especially the oldies. Remember, what happens is when you have back pain, after walking for a few meters, okay, let's say 5 meters, 10 meters, or let's say 5 minutes or 10 minutes, what happens is you start feeling pain in your leg or weakness, and you feel like sitting down, or you feel like bending forward. Okay.
Yeah.
Sit, or when you bend forward, your pain completely eases. Okay, I'm talking about people of higher age groups, or even youngsters with a disc issue, with a strong disc issue can have this. Now, this is something called as canal stenosis. Okay, in which what it means is that aje canal chena, this is a canal, okay, through which the cord is coming out. Okay, so અહીંયાથી nerves આવે છે બહાર. તો આ જે ગાદી, okay, for any reason, if this canal is getting smaller, then what it does is, it is called stenosis. Basically, someone's choking your neck. Agar આખી દબાવી દીધી, so it's gonna, you will die. But thodi hase, so you will have only changes. So for those kind of patients, we need to address, differently. They need to speak to their GP. They have to see their specialist, either me, and they will have to be referred to a spinal surgeon, and then taken from there. But if it is a conservative case, if we can manage it in, with the help of a physiotherapist, if you go and see them, they will be able to guide you, and they will be able to tell you what's the next step from there.
Okay, I think the second one is similar, very similar, but she is saying if a few days, if she takes ibuprofen 200 mg twice a day, it helps her, and then she'll stop taking it, but then it's back to the same thing. So this is a similar case.
Yes, with medication, always remember, you have to understand why you're taking the medication. The role of medication is to calm the pain down. Okay, it's
Absolutely.
a painkiller, it's an anti-neuropathic drug. It is doing its job of what it has to do, but you have to draw a line somewhere. How long are you going to take it? Okay,
Yeah.
if you've taken it for 3 months, you've taken it for 8 weeks, 12 weeks, for 16 weeks, then you need to go back to your GP and say that, yes, listen, this is what is happening. When I take the medication, I feel good, but after that, I'm going back to normal. Now, if you've taken the medication and the pain is coming down, okay, and if let's say if you're taking an anti-inflammatory, then it says that there is some inflammation which is settling down, and hence you're feeling better. But the point here is that we did that in the first place to calm the pain down, to get you to exercise or to get you to move. So if you start doing exercise and then start feeling better, then good. But if you've calmed your pain down and still you're not able to exercise, still you're struggling, every time you get back to work, you're again, having pains and aches, then it really warrants that you go and speak to your GP, and let's say what happens from there. They need to look into it. But remember, for especially people above the age of 55 and 60, you will have degenerative back pain. Okay, that is, I might sound very blunt or something, but I keep saying this. It's very important to be honest rather than give you false hopes. You will have good days, bad days, worse days. You're going to have back pain. Okay, you will have good days, bad days, worse days. It is very important that how you manage that is very important. If you don't do anything and you're expecting it to get better just by taking painkillers, you are expecting something which is impossible. You have to try to do something about it. You have to take painkillers, but also you need to exercise. And exercise has to be a lifestyle. It has to be your companion. If you think that, I will do it only when I am in pain and I will not do when I'm not in pain, you are just fooling yourself and nobody else. It is going to come back to you again. So if you want to remain better, and if you're working at the same capacity, okay, તમારું દિવસનું કામ તો સેમ જ છે. તમે અગર કામે જાઓ છો, or whatever you do, it's all the same. So if everything is still the same, your work and everything, and then you exercise for 3 months, you still do the same work, and then you stop exercising and you still do the same work, this is again going to affect you, isn't it? તો એ લોડ કેપેસિટી પર ધ્યાન રાખવું બહુ જરૂરી છે.
Okay, yeah. I don't know if you know Jitesh Pai. He helped us with the COVID-19 we did last week. Jyotiben knows Jitesh Bhai. He actually has provided a 7-day chiropractic advice program prepared by himself for his community. And he said we can borrow them if anybody wants, if any requesting to see them. The subject he follows is on back pains, headaches, sitting postures, bone health, osteoporosis, rheumatoid arthritis, top 5 health tips, all included in there. So, ladies and gentlemen, if anybody is requesting these videos, please try and contact me or my team in Women to Women, and we will try and put it down on Facebook. It's also Facebook friendly, so we'll try and put it on Facebook and we'll put it on our groups as well. I don't know, Jyotiben, if you've got any more questions for him, for Suraj Bhai.
Suraj Bhai, just a couple more questions that are quite specific. So there's one gentleman, 69 years old, and suddenly his back gives way. Thorak divas lage છે ને પછી it becomes back to normal. So કેમ થાય છે, and is there anything he can do in the meantime so that his recovery is faster?
Yeah. So again, I need to know more details. For any of these specific cases, I'm happy to guide you off record. But with my incomplete understanding of the case, not a complete, but an incomplete understanding, I would say that if someone's 69 and is getting back pain on and off for a very long time, most likely it is degenerative back pain. Okay, as I was explaining before, that you will have good days, bad days, worst days. That's how it behaves. Okay, there is unfortunately no quick fix around it. I cannot tell you that you do this one thing and you're going to, there is a shortcut for that. But the advice which I've given you in the talk is the same advice which is going to help you. So try to be active, try to exercise, build up on the strength. My only suggestion would be, if you're doing exercise only lying down, try doing exercises in standing position, in weight bearing position. That will further help you to get better. Okay, but other than that, yeah, if it's coming and going, and if it's there, if you've tried exercises, if you've taken medications, you've done this for 3 to 6 months, and if it's still not getting better, then you need some medical advice. You need to go back to your GP and ask him to give you some advice or send you to an expert or a specialist, because then we need to look into it, that why is it still not getting better in spite of you doing everything.
So that's really very useful advice. So Jemnebi Sawal Pucho, I hope Suraj Bhai has answered that adequately. Bijo ek sawal છે, કોઈકને ચાલતી વખતે દુખાવ થાય છે, અને or I don't know if it's a he or a she, but they've described it as a pulling sensation. આપણે નહીં કે ખેંચાય છે. And પછી એટલે લાંબો સમય માટે પછી નથી ચાલી શકતા. And sometimes he also has pain radiating to the shoulder and the neck. So is there any relation there when they're walking?
So he's got pain when I missed the first bit. I don't know what
pain on walking feels like it's pulling. અને લાંબો સમય માટે એ કારણે નથી ચાલી શકતા.
And he's got pain in the lower back or the upper back?
It sounds like lower back.
Okay.
And then radiates to the shoulder and the neck.
Yeah. Now, again, there are going to be multiple reasons why you can have, and what we've spoken is just, it's like a droplet of the big ocean, which is back pain. So again, keeping very limited information in my mind from what I have over there, yes, you can have, there's a possibility that you can have, generalized spinal pain, okay, because of the changes or whatever, you can have that. You can have two separate issues, which is back and neck separately, but it's both are getting aggravated with walking, okay. And the third possibility is, again, coming back to stenosis. If you're walking for for a while, and if it's giving you pain, and if it's in the back, then it can be related to stenosis, but not from the neck. So sometimes also what can happen is you can have just normal back pain, but because of you not being active, or because of you not being not doing anything, it can happen that it can lead to further decondition, and then it can also lead to pains and aches otherwise. Also, there is something in other places. Also, there is something which is You can have spasms in the muscle, you have pain starting in the lower back, and to protect that, then you have other muscles working, and the whole back can go into spasm because of that. But it is yeah, with the limited understanding I have, it is going to be either of these. But what I would recommend is, if you've tried everything and if you're still not getting better, speak to your GP and explain them that you've done all these things, and what's the next step from there. But in terms of doing conservative management, remember, anybody and everybody, if you're trialing non-operative methods or non-injection methods, then the answer is you should do a good 3 to 6 months of exercise, good 3 to 6 months of lifestyle changes. You need to do good 3 to 6 months of, if you require whatever on and off intermittent painkillers, if they need to calm the pain down. If you've tried everything and then it's still not getting better, then it warrants you to go any further. But in between, if there is a sudden change in your symptoms, you see something new, completely different, not aware, yes, more than happy for you to pick up and speak to someone and get an understanding of what's going on. But give some time. You have to be consistent. Remember, if you're not consistent, you're not going to get results.
Brilliant.
Can I just add to that question? It's the very same question, but this person, he says he walks a little and his both get heavy and he has to stand for a while. Then he starts up again. Any
Panaben, I
reason
lost
why
you in
he
between. I don't
should
know why.
have heavy legs?
Panaben, no, I lost you in between. I could not hear you at all.
Okay, it's a similar question, but he's added to.
Your hat matches your hair color. It's half silver, half black.
Yeah.
Sorry. It's the same question, but this guy has added a little bit more to his. He's saying when he walks a little, his both legs get very heavy and he has to stand for a while and then he starts off again. But he doesn't understand why his feet gets very heavy.
Yeah, this is possibly sounding like a classical canal stenosis. If this gentleman is old and, if he's had this for a while and if his walking distance has deteriorated over a period of time, and first he was walking 20 minutes and getting this, and now it's coming after 5 minutes of walking, then I would recommend you speak to your GP, get a referral to any, there is interface clinic or there's a spinal specialist clinic, or you can see someone like us, we are CATS clinicians sitting in primary care, who will, investigate as appropriate. They will have to look into it, but this requires attention.
Jyotiben?
Can I ask a question, please, Panna? Or get his contact number, please?
Yes.
I've been waiting for ages.
I'm sure he'll.
Suraj?
Yes.
Perhaps we can discuss his contact number outside of this forum, because I don't, it's full-time job, Chairman, so I don't think he can cope with 400 people calling him for advice.
I know. I'm one of from Women to Women,
Yeah,
and I
that's
really
fine.
need to ask you a simple
That's
question
fine.
quickly.
No, so I live in contact number, but
Yeah.
but yeah, please do ask your question.
Yes, Suraj, I just want to ask you something. I had 3, 4, 5 decompression and diffusion 3 years ago. And then I had a everything was fine after that. I had a hip replacement in July, end of July, and I've got a drop foot.
Mm-hmm.
Why are that? I'm still not better. It's 5 months on. Anything you can recommend? They are saying physio. They're going to do another nerve test to see if my nerve is functioning or not. It's from my knee downwards. I'm completely numb, my toes and everything, and I'm having falls because my toes bend.
Mm-hmm.
I have to wear a foot brace to walk.
Yeah.
And I walk with crutches.
At this point in time, I would only suggest that I'm happy to discuss this later with you, but only one thing. If you've got a foot drop, it's very important that you get an AFO, which is an ankle foot. You need to get an ankle foot orthosis, which is a support so that
that's what I wear.
Yeah.
That's
okay.
What
If you're wearing that, yeah, we have to understand that why you have the foot drop, possibly from what has happened in the past. But I cannot really comment until we have seen your MRI or your NCVs, or we have to speak in details about it.
Okay. All right. No problem. Thank you.
Sorry for that.
It's okay. Thank you.
Welcome.
That's a great answer. Thank you, Suraj bhai. એક કોઈ બીજું પૂછ્યું છે કે એ લોકોને અહીંયા દુખાવ વધારે થાય, but when they go to India, એ લોકોનો દુખાવ ઘણો ઓછો થઈ જાય. So એમાં કોઈ weatherના કારણે છે કે ખોરાકના કારણે? What do you think is the reason behind that? કે ત્યાં પછી માલિશ બહુ સરસ થાય છે.
Now, back pain is, as I was saying, that it is also how you feel. તમે ઇન્ડિયા જઈને તમને બહુ સારું લાગે છે અને તમને મજા આવે છે ત્યાં, તો તમે બધા દુખાવો ભૂલી જશો. Not only back pain, you will forget all your aches and pains. But on a lighter note, but on a serious note, yes, sometimes what happens is people, when they're in cold country, like one of them is UK, yes, you tend to protect yourself a lot. The body tries to protect itself a lot, and that can sometimes lead to a lot of things, like you can get some increased stiffness in the morning. You can get common neck and back pain because you want to be koka thaine revu game. We don't try to be we can't be open completely, but there is no strong evidence to say that temperature changes affect anything in the body in terms of it is going to make any changes. I'm talking purely about back pain. I'm not talking about any other conditions here, okay? But it is, yeah, it can happen. We have seen that, but it does not change anything. You have to still if you are in a cold country and you want to live here and you're going to be here for a long time, you might as well find a way to exercise at home or anything. But the answer still remains the same, which is go back to your basics, which is exercise.
So that's useful. And then finally, because I think એટલા બધા સવાલો છે, આપણે આખી રાત અહીંયા બેસીને બધા સવાલ
Exactly.
જવાબ કરી શકીશું, but perhaps તમને બી થોડોક આરામની જરૂર છે હવે. So let's perhaps make this the last few questions. Just a couple of comments. You've had very, very good feedback, and it's lovely કે અત્યાર સુધી આટલા બધા લોકો હજી બેઠા છે. So that's wonderful. Just goes to show how much you have interested everybody. ઘણા બધા લોકોએ અહીંયા chatમાં લખ્યું છે કે please તમે પાછા આવીને ઘૂંટણ ઉપર knee pain, ankle pain, એનો કઈ session કરજો. I mean, knee pain is so common for everybody that I'm sure would be useful for all men, women, all ages. So પન્નાબેન તમે વિચાર કરજો, સુરજભાઈને પાછા બોલાવજો. So
Absolutely.
the last question from me, Suraj bhai, and you've done really well, very good, is are there any supplements that you would recommend? Vitamins કે તમે recommend કરી શકો? I know ઘણા લોકો glucosamine વાપરે છે ને bone health માટે.
Yes.
But is there anything you would recommend? Some other people talk about oils and what have you. So what would you recommend?
Again, I'm not the best person to answer this question, but with my knowledge, which I have, I'm not going to really comment, I will tell you what I know and what evidence is there. Okay. There is no evidence, for glucosamine. There is no strong evidence for glucosamine or chondroitin sulfate or anything, because if that was the case, then, NHS and NICE would support it. NICE is the structure, je આપણું આખું જે NHS ચાલે ના, એની જે governing body છે, that is NICE, okay? અને એ બધું decide કરે. So, અગર આવું કઈ હોત, તો it would be on the NHS. તમને મળ્યું હોત અહીંયા પણ, if that's why I keep saying, મસાજ થી બધા ઠીક થતા હોત, તો એ NICE એને recommend કરે. અને NHS માં તમને એ મળે. આવું કઈ નથી જે આખા વર્લ્ડમાં જેનું સારું એવિડન્સ છે, okay? અને અહીંયા નથી તમને આપતા કે નથી મળતું. First. Second, yes, you have to sorry, I'm in clinic, Jyoti Ben, and this might push me out, so I'll quickly answer. I've got 1 minute now.
Oh, okay.
But I can join from my phone quickly. 1 minute if I come out, and I'll come in again. Quickly on that note, any food supplement you need, you need for bone health, which is D3, and you need, calcium, but that is all in the grounds of, you should first speak to your medical professional and they can guide you on that. That's the best thing to do. From my point, it is very important to maintain your D3 levels, and it is maintain, have your, in this, especially if you can't get it naturally here, then you might have to take some supplements for that. That is important. But anything other than that, if you've got osteoporosis or you've got osteopenia, which is bone conditions, which are metabolic conditions, basically, tamara bone ma agar kai na, a soft થઈ ગયા છે કે કાઈ થઈ ગયું છે, એ બધા માટે.
Oh, I think એમનું session time out થઈ ગયું છે, ક્લિનિકમાંથી હતા ને. So on his behalf, I will I can call him with any other questions, but I think Pannaben must be time to wrap it up then. Come and mute, Percho.
Yes, it is time to wrap up. So before I say my Om Shanti, can I thank you all from women to women to attend this function, and it was a brilliant session. And thank you very much, Jyoti Ben and Suraj Bhai, to do this for us. Very, very informative and explained clearly, so we could digest that. I really, really do appreciate it. Thank you, everybody. I really appreciate you.
Yeah, sorry, I'm back.
Yeah, same,
perfect.
everybody nice, fine, go, fine. Nice.
Okay, can I just say Om Shanti?
Just Pannaben, once again, can I just say thank you to everyone?
Tum soma jyotirgamaya mrutyumamrutam gamaya. Om Shanti Shanti Shanti. Om Shanti Shanti Shanti. Om Shanti Shanti. Once again, I thank everybody. A special thank you from Women to Women to Jyoti Ben and Suraj Bhai. And we will definitely call you again, Suraj Bhai. It was a full house. Everybody appreciated for you to give us this talk. And as I said,
thank you.
it was very informative. So we really thoroughly enjoyed your speech, and your PowerPoint was brilliantly explained. Thank you very much,
Suresh Bhai.
Very
Thank
nice.
you, everybody. I think you were just about to say something before Panna wrapped up. If you want to say it.
I'm just trying to recollect. What was the question?
You were trying to say thank you.
She's our founder.
Yeah, no, I don't know what I was saying, but yeah, thank you. Yeah, thank you, Geeta. I don't remember what I was saying. I'm sorry.
Can I also
you were trying to say thank you, Suraj Bhai.
Okay, thank you then. Thank you, everyone. Thank you to Panna Ben and Geeta Ben and you all at W2W for organizing this and having me. I hope I've done justice and you all like
You have, Suraj, because I've had back problem for years and years. And what you said was very correct.
Thank you.
Okay.
Thank you.
Thank you. We look forward to seeing you again.
One last minute. Can I just remind you, we've got another session on Friday on health awareness talk. And this is very brilliant. It is a must for everyone to look into this. It is to eat real food and how to take, why do we have to take vitamin B's and vitamin C's? So please try and join in on Friday, coming Friday at 8 o'clock, which is worthwhile for your benefit as well. So I appreciate if you join in again on Friday. Thank you very much again.
Thank you, Panna. Thank you, Jyoti Ben.
Thank you very much. Thank you, Panna. Excellent. Very good work. Thank you, Panna.
Thank you. Thank you very much.
Welcome.
Thank you very much. Very informative. Thank you.
Welcome all.
Good night, all.
Pannaben, could you send the link, please? Friday.
It will be
Just be patient.